Okay, while we wait for a few more people to come in, we'll just get started. This is Bridgette from Brigham City Community Hospital, and she works in their mammography department, so she's going to talk to us about mammography and breast cancer screening and things like that. So. Okay, I'll stick this right here. All right. Well, so I'm here today to answer the question I get from everybody is, do I need a mammogram? And the answer is always yes. So there are a lot of confusing guidelines and things that you're going to see on the news, especially with October breast cancer awareness coming up. So hopefully today I can clear up most of your questions, and you're always welcome to answer or ask questions at any time, so you just let me know. But yes, you do need a mammogram. So this is basically the connotation that most people think of when they see the word mammogram. This is exactly what they start thinking about. And for my baseline mammograms, most of the women who are coming in for their first time are super, super afraid. And it's because of the same reputation that the mammogram gets. But 98% of the ladies who come in for the first time are telling me it's not as bad as I had anticipated for it to be. So these are some of my favorite cartoons, just about mammography in general, and the way that it actually does make women feel. So today we're going to talk about our bodies as though it's our dream house. So our bodies are something that we obviously have invested a lot of time and money into, something that we just want to make sure that we're maintaining really well on a daily basis. So if I was to build my dream home, the very first thing I would do is probably put a nice security system in there, just making sure that it was always protected from intruders. So today we're going to talk about our screening exams as a security system in your home. So our screening mammography exams will sound the alarm against the invaders in the breast room of your home. And that there is just an image of an invasive breast cancer. So let's talk about Utah in general. So believe it or not, Utah ranks number 1 for breast implants in the nation, with breast inquiries for breast implants 74% above the national average. Is that surprising? Yeah. So per capita, you would think that California and other places with a lot of movie stars and plastic surgery would be number 1, but per capita, we are number 1. Yeah, so even with all the interest in breast, though, Utah mammography rates have stayed stagnant or below the national average for the last 15 years. So when we look at screening rates, mammography in Utah, we are number 49 out of 50, and Idaho is number 50. So I find that very interesting because in our culture, family is really important to people around here. And if you're not getting your mammogram, you're not going to be around to take care of your family. And we are nearly the worst in the nation. And when we look at the state, Box Elder County is second to last. Garfield County is the worst. And we are second to the worst in the state. So nearly the worst in the nation right here in our small little county about getting screening breast exams. Believe it or not. Isn't that surprising? So this means that more Utah women are finding late-stage cancer and facing harsher treatments and decreased quality of life because they're finding it late stage. So it's time to get your mammogram. Time to schedule. Today, at the end of our presentation, we're going to talk about some time that we have open for county employees to come in and have a mammogram with us at Brigham City Hospital. But I always tell everybody this squeeze is a breeze. We try and keep our time slots at 20 minutes, so by the time you check in, get your mammogram, and leave, it's usually pretty fast, and you can get right back to work. So let's talk a little bit about some of the things you're going to start hearing in October. There's always a media frenzy around screening mammography and the guidelines. So one of these is a Canadian National Breast Screening Study. I don't know why they're using Canadian statistics in America, but they do. And I think mostly because it raises eyebrows. So you'll see this appear in the New York Times, the Chicago Tribune, and you'll see it on the news. This study tries to say that screening mammography is not valued between the ages of 40 and 49, which actually is a lie. So this is where this trial went wrong. A lot of people don't really know what went in behind it, and it was such a false and bad trial. I don't know how it made the news, but it did, and I think simply because of its results were controversial. But they said that they had a randomized screening group, but actually it was not. They had women with advanced stage disease admitted into the randomized group, and the accuracy of the interpretation of the mammography films were actually called into question. So the radiologist only had 1 month of training, which obviously is not a true radiologist. The technologists were not educated in proper positioning or technique, which a bad mammogram is actually worse than no mammogram. And the imaging quality was so poor that the physicist associated with the study withdrew because he thought it was so poorly run. So they still came up with some stats, and their stats claimed that they believe that mammography between 40 and 49 isn't valued, but it definitely is. Because breast cancer death rates have decreased since the implementation of mammography in the early 1990s by 30%. And women are more likely to survive breast cancers if these tumors are found during their mammogram exam. And most of the deaths from breast cancer do occur in younger women of a working age because it's very popular in the 40 to 49 category, more than you would think. So regular screening before the age of 50 is definitely encouraged. And from a business perspective, early detection saves your business up to 56% of sick leave costs and nearly 12 times lower short-term disability costs compared to late-stage diagnosis. So the county's doing a really great thing at allowing you guys to come in and be screened because that's going to affect their bottom line. And patients with NETs, when the cancer is spread to other parts of their body, will incur 48% greater short-term disability costs than patients with early-stage breast cancer. So breast cancer is more prevalent in women of a working age, and if it's caught early, it can be 100% treatable. So this is a 3D mammogram machine. A lot of people who haven't had a mammogram are really, really scared and worried about what everything is about. So this is the mystery, and this is what the machine looks like. It's produced by a company called Hologic, and Hologic is the gold standard for mammography screening equipment. And when they did the trials on this machine, Hologic asked the women involved what they would name the machine, and they said they would name it Genius. They thought it was a genius exam, so it's called the Genius Dimensions Hologic machine. So let's just use a little bit of an idea of what it's like to have a mammogram. So the woman is put into the machine, the breast is pulled forward, making sure to pull all the breast tissue off the chest wall, and then the compression paddle comes down and compresses you between the detector plate on the bottom, which is what receives the radiation and creates the image, and the clear compression paddle on top. So compression also gets a really bad rap. So I'll explain a little bit of why we do it. It's really not just to torture people. The compression is applied to the breast to reduce the size of the breast. So the thinner we can make the breast, the less radiation it takes to penetrate it, so the less radiation the patient is exposed to. But also to separate the tissues in the breast. So the more compression we put on it, the tissues separate from each other, and we get a more clear image. And we're able to see through the breast tissue a lot better, so we're getting better films, okay? So it is always encouraged to take as much compression as possible. The purpose of screening mammography is to find non-palpable breast cancers in the breast. So a lot of people say, well, I don't have any lumps, so I don't really need a mammogram, but you do. We want to find them before you can feel them. If you can feel them, it's usually advanced a little bit farther. So these new machines that we have now can find breast cancer 3 to 5 years before you can actually feel it in the breast. When it comes to 3D mammography, you're going to hear a lot of different terms. So you'll hear 3D, you'll hear tomo, you'll hear digital breast tomosynthesis, or DBT. It's all the same thing. So digital breast tomosynthesis is a 3D imaging technology that acquires a series of low-dose projection images of the compressed breast at different angles. So the new 3D machine, when you're put into the machine, the tube head usually stays stable when you have your 2D mammogram. On a 3D, it rotates to the side and creates a 15-degree arc across the top of the patient. It's taking 15 small projections. Those images are then reconstructed into 1 millimeter sliced images. So the ending result looks similar to a CT scan or sliced bread. We're now looking at the breast 1 millimeter at a time. So we're getting 300 to 400 pictures of the breast instead of just 4 flat images. So obviously, the more we can see, the more accurate we are. So this here just is a little bit of demonstration of what the tube is doing when it arcs over the breast, and you can see the reconstructed images at the bottom. So one thing that is so bad about 2D mammography and why 3D is so great is we always got tissue superimposition. So when all of those tissues are put on top of each other, we can't always see what's in the center, and everything overlaps each other. So it's really hard sometimes to tell a benign piece of tissue away from a malignant piece of tissue. Or sometimes malignancies can hide in the center of that dense breast tissue. So this is a demonstration of that. The red star is a cancer. The blue things in the breast are all other benign conditions or densities in the breast. When you're looking at it from the top down, it's hiding the star. You can't see it because there's other dense tissues overlapping on top of it. So 2D mammography was definitely better than film, but we were still finding later stage cancer because by the time it emerged from underneath some of those superimpositions, it was a little bit later stage. But 3D has fixed all of that. So now we're getting this stack of images. So one at a time, we filter through the breast. So we're seeing these benign conditions in the breast, one slice at a time, and then we find a slice with the cancer on it, and we can see it clearly now, whereas before it was hidden. So if you think of an apple, and we're slicing the apple down, you can see all the way through the core, you can see every single detail inside of it, and we can now measure exactly where the lesion is in the breast based off of those 1 millimeter slices. So it takes the guesswork out of biopsying, as well as women are not losing as much breast tissue now as they used to in biopsy, because we can locate it specifically. So this is what a suspicious lesion looks like on a two-dimensional mammogram. So you can see what's inside of that square also looks really similar to some of the other dense breast tissue in the image. But because this woman came in on an annual basis, we were able to see that this was different from last year, which is why we encourage annual mammography. We want to be able to look for small changes in the breast, and that's what tips us off into looking into something early. So that 2D as compared to a 3D of that same spot, it's obvious that that patient has breast cancer. So that's how much more clearly we can see with three-dimensional. This is another example. On the left, it doesn't look scary at all. It just looks like dense breast tissue. But when you slice through the center of the lesion, it's obvious that it's cancer. I like this one because the image on the left is a two-dimensional image. The image on the right is 3D. It's the same area of the breast, but you can't even see the lesion on the 2D. It's not even visible. So this woman probably would have gone another year or two before the lesion grew large enough for us to catch it on two-dimensional, but on the 3D, it's obvious. So the 3D has really made a difference. We were two-dimensional in 2014. I used 2014 and 2017 because our number of screening mammograms were very similar. 2017 was our first year being 3D for a full 12 months. So we used to call a lot of patients back with two-dimensional because we were looking at those superimposed tissues and it was confusing. So 154 women that year got the anxiety phone call that we told them they needed to come back and take a second look. And out of those 154, only 4 of them were positive. So that's a really high anxiety rate on the diagnostic mammogram. So looking at 2017, we only recalled 35 patients because we could see so much better. And out of those 35, 10 of them were positive. So those are pretty alarming numbers when you see that our cancer detection rate from 2.6% to 28.5%, that's incredible. So a lot less false positives, definitely more accurate, finding more treatable cancers. The smallest cancer I found in the last 2 years since we've been 3D is 4 millimeters. So itty bitty, able to just be cut out of the breast, no other treatment, because the 3D is so specific. So let's talk about the male breast. Male breast cancer does happen, and it is suggested that men, just like women, are suggested to do a monthly self-breast exam. Because obviously it's not as popular in men, but it can happen. We can fit men into the same mammogram machine that we do women. Their tissue is still pliable. We can still pull it in there. So this is just an image of what it's like as a man to have a mammogram. And this is an image of a male breast cancer. I've been doing mammography in Brigham for 12 years now, and I've only found 1 male breast cancer. So 1 in 1,000 men develop breast cancer, as in the 1 in 8 women that develop breast cancer. So I want to talk about some of the myths and lies and things that I hear a lot from patients that I really want to get cleared up, so maybe some of you have these same questions. The first one, just being, if I don't have any symptoms, I don't need a mammogram. But yes, you do, because the whole point of mammography is to catch it before you can feel it. So you still need to come in on an annual basis, making sure that you're getting your mammogram done so that we can find that cancer at an early and treatable stage. Number 2, I don't have family history of breast cancer, so I don't need a mammogram. But the statistics here are pretty alarming. 80% of women who develop breast cancer do not have family history. So 3 out of every 4 diagnosed, no history. If you do have history, it does run your chances higher, but if you don't, it doesn't mean it's not going to happen to you. And I had a normal mammogram last year, so I don't need another one. It's also false because once is not enough. We want to make sure we're imaging every year. The breast goes through a normal changing process that we call involution, where you're going from dense, glandular, functioning breasts at a younger age, and over time, they start to go through this involution process and go from dense to fatty as you get older. That's why we start mammography at age 40, when the hormones start to level out in the body and we're able to see through more fatty breast tissue. And so your breasts are changing so much, it's important that you come in. And those hormone levels are changing, and a lot of breast cancer is fed by both estrogen and progesterone. So we want to make sure that we're keeping an eye on things. So when it comes to screening guidelines, there are 6 different bodies that come up with the guidelines. I've only listed 4 because the other 2 are extremely confusing. And when you look at the 6, 4 of them agree, the other 2 don't even agree with each other. The other 2 are the U.S. Preventative Task Force, which is simply a government entity. There are no medical professionals that serve on that committee, but they've decided to come up with their own guidelines. And they do not recommend screening at age 40, and they don't recommend annually either, which I highly disagree with. The other is the American Cancer Society, and they just want to try and play it safe. So they've included a little bit of what these guys say and a little bit of what the U.S. Preventative Task Force says, and it is confusing. So these are 4 very trusted societies. When we're talking about the American Congress of Obstetrics and Gynecologists, the American College of Radiology, which is what we function under at the hospital, and the Society of Breast Imaging, the American Medical Association, and the National Comprehensive Cancer Network, which pretty much every oncologist and hematologist, when treating cancer, goes by the standard set by the National Comprehensive Cancer Network. So all these people are saying to start at 40 and to come in every year. So when we talk about risk factors, the number 1 risk factor is the fact that if you're female, that runs you a high risk of developing breast cancer, and then your age. So 1 in 8 women at the average age of 85 will develop breast cancer. So a lot of women are asking if there's a top-out age, and there is no top-out age because obviously your chances are increasing with age. And if you're healthy enough to come in and have a mammogram, and you would treat it if you found it, you should have a mammogram up into your older ages. So, but even if you're looking at the age of 40, 1 in 68, I would still say that's worth a mammogram. Those are still pretty alarming statistics. And this is a chart just to kind of show you the difference between men and women. The men are the black line at the bottom. They increase slightly with time, but women skyrocket. Mammograms are too painful. So a lot of people don't want to come in because it hurts. So if you are on hormones, that can make your breasts a little bit more sensitive. And depending on where you're at in your cycle, can as well. But the compression in your mammogram should be uncomfortable, but not painful. And the only person who can draw that line is the patient. So I always let my patients choose when they want to stop with that compression force. Your breast is in the compression for 15 seconds. We do that 4 times. And it's not too bad for a life-saving procedure in my book. It's uncomfortable, but definitely worth it. And I always want my patient to tell me how she feels, because if you're having a poor experience, you're never going to come back. And it's really important that you do. So I want my patients to make sure that they're comfortable while having it done. But it's also your job as a patient to kind of put yourself in that uncomfortable category. Take what you can while you can. If we don't get enough compression on the breast and the breast is not put in a stable position, we'll get motion in the mammogram. And if we're not compressed enough, then we can't see clearly through the tissues because they're not separated enough. So the breast is typically compressed anywhere between 12 and 45 pounds. 45 is the maximum, and there's really no need to overcompress the breast. So timing for your mammogram should be done around your cycle. So if you are still experiencing a cycle, your breasts are obviously going to be tender the week before. So it's best to schedule your mammogram the week after, when your breasts are no longer tender, because it will make the compression more comfortable. So let's talk about breast implants since we're number 1. A lot of people are afraid they're going to pop, but breast implants are designed to take about 200 pounds of compression, which the mammogram machine obviously does not apply. And I'm just afraid of them popping, as you are, but plastic surgeons have trained us in the fact that they should not rupture from the mammogram. So the most amount of compression I will put on an implant is 7 pounds, which is barely just enough for that compression paddle to come down on top of the breast. I just want to make sure that there's no motion in the image, okay? So we do special views for implants. They're called Eklund views. So women with implants get 8 pictures instead of 4. We bring the full breast, including the implant, into the picture, put light compression on it, and we take 4 views that way. Then we push the implant back into the chest wall and compress the tissue that lies in front of it, again for the same reason of separating the tissues and seeing through them more clearly, and then we take those images as well. So a lot of women, when it comes to having their implants imaged, are obviously nervous because of the compression. We do have to have you sign a waiver for that. But also, you can see how much of the breast tissue that the implant obscures. We're not able to see around all of that. we do our best to push the implant out of the way, but once implants have been put into the breast, we're not able to image 100% of breast tissue, simply because we can't get around everything that the implant does obscure. But it's still obviously very important to come in. We want to image as much as we can so that we can still look for early breast cancer. So my doctor didn't tell me to get a mammogram, so I don't need one. So that's a lie too. What I want you to do is take your health into your own hands. Mammography will be covered by your insurance as a screening mammogram once a year. So your doctor doesn't have to send an order unless you're having symptoms. If you're having unusual pain or a new breast lump that hasn't seemed to go away in the last month or two, then I would suggest seeing your doctor and getting an order for a diagnostic mammogram. But if you're not having any problems, then you can come in and call yourself and just come in on an annual basis. And once you're in our system at the hospital, we send reminder letters twice a year just to remind you to come back in and have it done. So another important thing to talk about these days is radiation levels. So people are really concerned about the amount of radiation that's coming from the machine. But I want to let you know that it's safe. Radiation, if you look at it on a graph, there's a threshold. Anything underneath the threshold is not cumulative. If you expose over the threshold, the body, it is cumulative over time and the body adds it up. But underneath that, it's not affected. So the mammogram falls in that category. We are the only federally regulated radiologic modality out there, so the FDA comes into my facility every year and puts me through a scrutinizing inspection, okay? So know that the amount of radiation that's coming from your mammogram is similar to 2 hours outside in the sun, or a hike at a high elevation during the middle of the day, or a cross-country flight on an airplane. You're gonna get the same level of radiation. So the FDA has a limit for each exposure, and that's 3.0 milligray. And with the way that we do 3D at Brigham, we're only exposing our patients to 1.45. So we're less than half. So you're in really good shape. When it comes to 3D, not all 3Ds are created equal in the fact that we do our 3D sweep. We get those 1 millimeter sliced images so we can see through all of those. Then we reconstruct them. We put them all on top of each other and create a two-dimensional reconstructed image. So we get to see your breast from a 2D perspective and a 3D perspective. Most facilities do that, but they expose you for the two-dimensional. So they do the 3D sweep, the machine comes back to the center, and then they expose you for a two-dimensional image, so your exposure is up at that 3.0. In Brigham, we're saving you a lot of that radiation, because Dr. Rock, our radiologist, he's fine to read off of the reconstructed image. They are FDA approved and ACR approved, and they are good images. So we do it in a different way. So we do the 3D sweep, and the reconstructed images are what we call a C-view. When it comes to time, most women say they don't have time for the mammogram. We really like to have you done in and out really fast. We try to schedule our patients every 20 minutes. By the time you're checking in, you get your mammo done, and you leave, you should be done in that 20-minute time frame. We try to respect your time so you can get back to work because you are busy women. And then what we went over earlier, most women say that they are too old for a mammogram, but again, there is no top-out age. So if you think of the older women in your life, just know as long as they're healthy and they would treat it if they found it, they really should continue to come in and be screened. So our scheduling number is there on the bottom, and we have been working with the county here to get you guys some dates. Between September 17th and the 28th, you guys are welcome to come in and get a mammogram. When you call the scheduling line, just let them know that you're with the county or your spouse is with the county, and we'll make sure that you get put in the correct slots. And then also, to entice you to come in, we always give out a really nice gift in October to all of our women who get a mammogram in October. But because you're coming in a little bit earlier, we're still going to give it to you. So this is a portable power bank charger. They're really cute. They're just about this big. They come with a cord, and you can carry it in your purse and charge your phone portably, which is really awesome. So it's always fun to have a little enticement. And then just know that early detection does save lives. I know you guys hear that all the time, but it's because it's a true statement. The whole point of this mammogram was to find these early non-palpable breast cancers so that they can be 100% treatable. So make the time to get screened because your health and future happiness does depend on it. Do you guys have any questions?
Do you want to go over the billing also?
Yes, thank you. Yeah. So your insurance company should cover the 3D. At Brigham City, because of those alarming statistics I showed you, we believe everybody deserves a 3D. So if you get a bill in the mail, just call us and let us take care of it. No extra charge to you, should just be covered, like a normal screening mammogram.
So if we do this without going to our doctor, we just send results to our doctor?
Yeah, we do. So when you come in and you tell us who your physician is, we usually have reports faxed to physicians within 24 hours, and then we send a letter to you, usually takes 3 to 5 days, and that comes to your home in the mail if everything's normal. I don't like to send letters out if mammograms aren't normal. I want to call you and talk to you personally. So within 1 to 2 days, you'll get a personal phone call from me if they find a reason to bring you back, and I can explain all of that to you over the phone. Any other questions? No? Okay. Well, thank you guys for your time. I really appreciate it. Hopefully you were enlightened and saw something new today that you didn't know before that you can share with somebody else. Continue to help save and change lives, okay? Thank you so much.